Welcome to our comprehensive guide on nailing your clinical instructor interview. If you're gearing up for this crucial role, you're in the right place. Let's dive in by exploring how you can effectively convey your teaching prowess with our first key question. Could you share an experience where you successfully taught a difficult concept to your students? This question is all about demonstrating your ability to handle challenging teaching moments effectively. Let's look at some tips to help you tackle this question with confidence. Choose a specific challenging concept that you have taught. Explain the context and the reasons it was difficult. Talk about the teaching strategies you used and how you engaged your students. Highlight the positive outcomes and benefits for your students. Reflect on what the experience taught you. Here's an example of how you might construct your answer.
In my anatomy class, students struggled with understanding the nervous system. I created interactive models and group activities to help them visualize neuron connections. This approach led to a 20% improvement in their exam scores, and they expressed greater confidence in discussing the topic.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Clinical Instructor. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Can you tell me about a time when you received constructive feedback from a peer or supervisor and how you responded? This question assesses your receptiveness to feedback and your ability to grow from it. Here's how you can effectively approach this question. Pick a specific instance where feedback was impactful. Clearly explain the nature of the feedback. Describe your immediate reaction and the actions you took. Discuss any changes or lessons learned from the feedback. Highlight the positive outcome or improvements. Consider this as a way of framing your response.
During a team project, my supervisor mentioned I needed to improve my presentation skills. Initially, I was surprised, but I took it as valuable advice. I enrolled in a public speaking workshop and practiced with colleagues. My next presentation was much more engaging, and I received positive feedback from the team.
Could you give an example of how you have mentored a student or junior staff member in a clinical setting? This question evaluates your mentorship capabilities and how you facilitate the growth of your mentees. Here are some pointers to help you structure your response. Select a specific student or staff member you mentored. Provide the context of the mentoring situation. Discuss the techniques or strategies you implemented. Highlight the outcomes or improvements you observed. Focus on your role and contributions. Let's look at an example answer for inspiration.
I mentored a nursing student during their rotation on my unit. We set weekly goals, and I provided direct feedback on their patient assessments. By the end of the rotation, they had improved their clinical skills significantly and gained confidence in patient interactions.
If a student consistently struggles to perform clinical skills, how would you approach the situation? This question explores your problem-solving skills and how you support students facing challenges. Here's how you can think about formulating your answer. Identify the specific skills where the student is struggling. Provide constructive feedback and identify knowledge gaps. Offer additional practice opportunities, such as simulations or one-on-one sessions. Encourage the student to ask questions and express concerns. Set measurable goals and regularly check in on progress. Here's an effective way to present your strategy.
I would start by identifying the exact skills the student finds challenging and give specific feedback on those areas. I would suggest extra practice sessions and encourage open communication to build their confidence.
Imagine you are supervising a clinical session and a medical emergency occurs. How do you handle the situation? This question tests your ability to maintain composure and leadership during high-pressure situations. Consider these strategies when crafting your response. Stay calm and assess the situation quickly. Ensure patient safety and call for help immediately. Delegate tasks to other staff or students as needed. Provide clear instructions for immediate interventions. Document the incident after it is resolved. Here's how you might articulate your approach.
In a medical emergency, my priority would be patient safety. I would alert others to call emergency services, assign roles clearly, and guide the team on necessary actions to take.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.